Welcome, everyone. I have 1 o'clock. It looks like that we have most of the board members joining relatively early. Thank you all. We're going to give it another, looks like 20 seconds, and I think we'll be ready to call for order and quorum. Dr. McGee.
Right. And another 20 seconds.
Give it 10 seconds now.
All right.
Looks like we're there.
Great.
I think we can get started. If we can have the slide advance too, please.
Great. Thanks, Doug. Welcome everyone to the February 19th board meeting of the OPTN Board of Directors. The first thing we're going to do is call for a quorum. The link is in the chat.
Thank you, everyone, for clicking on the quorum link and noting you're here, and we'll get started as soon as we can. Dr. McGee, quorum has been reached.
Great. Welcome, everybody. Thanks again. Just as a reminder that we're currently in open session. Thank you for the members of the public who are joining and listening. Again, as has been stated before, please keep your video on if possible. Keep your microphone muted. The ability to enable or disable closed captions is present, and please use your hand raising to ask questions during the Q&A or open forum, and use chat for technical issues, as it often is not monitored on the pace that you'd want it to be. So next slide. Our first, this is kind of the agenda for today. We've done the call to order and quorum. We're going to vote on the previous meeting summary. I'm going to give an update on kind of active issues right now. There'll be an opportunity for other new business, and then we're going to move into closed session and then adjourn. So next slide. So the first action item is next slide is to approve the minutes from the January 15th Board of Directors meeting, which was in the box and in the materials circulated ahead of time, with the ability of the secretary to make non-substantive changes as necessary. So there's a motion there's a motion in front of us. Can I have somebody agree with the motion?
Motion to approve.
Great, thanks. Can I start? Second. All right. All in favor, please. I'll be popped in the chat.
It is now popped in the chat. Please click on the link to vote for the approval of the meeting summary from January 15th now. All right, we have the motion did carry up 26 approve, no rejections, and no abstentions. Thank you all.
Thanks, Doug. Okay. So we're now going to give some updates regarding current activities. So before we start, I do want to take a moment to acknowledge, we're in the midst of some challenging times. We know the change is necessary, and it's important to recognize we're in the midst of a fundamental transition in the way we do things. The bridge period is hard on all involved in the OPTN, but it's the only path forward. I often have begun these meetings by just reminding all the OPTN Board of Directors that our fiduciary responsibilities to the OPTN and the donors and the patients we serve. Just as a reminder, during this bridge period, the system for listing patients and matching donors and candidates continues. The vital work around patient safety, including MPSC and the Disease Transmission Advisory Committee, continue. There's an MPSC meeting later this week, and that the results of those meetings will be brought forward to the board. And other critical work related to secretarial directives, including allocation out of sequence and NRP, continue, and we'll be given a brief update on there. I think we all signed up because we supported change, and change is a process that often moves slower than we wish. I mentioned that a lot of the work of the board is approving and interacting with committees, which many of the standing committees have not been meeting during this transition period. I will note, however, that we're standing them up as necessary for urgent patient issues, patient safety, operational safety. There are two committees, as the board members will recall. The OPO committee had comments out on DCD, and the DTAC had comments out regarding the rabies policy. They're finalizing the collection, or excuse me, the classification of the public comments related to those, and the committees will then be addressing those comments and then bringing them forward to the board as has always been done in the past. So that component of policy making continues, and we'll give some updates. And again, in this period of transition, we need to focus on resources. That's always true, regardless of whenever we were, but particularly in this time of transition where we're working through some change, including standing up new contractors. We're also transitioning to a new website, which I think will be a substantial improvement. There's been some onboarding on that already. It will improve both security of access to the materials, as well as the structure in which they're provided. So committees and board members will be updated and onboarded into the OPTN 360. I've also been asked about committees holding meetings. Can't we just hold a meeting? And unfortunately, because the way this is a public-private partnership, and to conduct business, we need both the OPTN volunteers, our colleagues at HRSA, and contractors to run and minute the meeting. So just having ad hoc meetings is not something we can really do that's consistent with our structure or bylaws. And just again, as a final reminder, the job of the board is to govern and not make policy, which given the fact that we're in a transition period, some of the components of governance or approval of committee work is just slower than it had been. So I just want to take a moment and again acknowledge that this change of time of change is a challenge for everybody involved, and thank you for your patience. So the first item to update on is regarding appointment of board compliance officers. So board compliance officers are required under the OPTN policy, and they support board integrity and code of conduct enforcement. I wanted to give a big thank you to Andrew Courtwright and Samantha Endicott for both volunteering to serve as the board compliance officers, as well as being approved by the executive committee, who confirmed their appointment. That is how it works in the bylaws. So they're now effectively the board compliance officers. And probably next board meeting, we'll give some update about what we'll be working on for the next period of time. Because of the timing, we're also have their term lasting until June of 2027. So they'll be serving 16 months or so, 15 months in these roles. So thanks again to Andrew and Samantha. The next item is just an update briefly about the implementation of the emergency lung continuous distribution policy. Again, as you'll recall, the board approved this as an emergency action. It was approved, and last month I sent a formal letter directing UNOS to proceed with implementation of the policy. They're still working on it. We've been partnering with HRSA, and they've been working closely with the contractor to realize execution on this. As another reminder, because it was undertaken as an emergency action consistent with our bylaws, that policy change will be going out for public comment within 6 months of it being approved by the board. Additionally, the board is we're working on implementation of the West Nile policy change that was approved. So we'll keep you updated on both the progress on both of those. The next item has to do with the allocation out of sequence work group, as reported to the board at our last meeting in January. The work group submitted its draft proposal to HRSA, and HRSA has returned feedback, as has board leadership. The work group leads are currently reviewing that feedback. We're setting up a meeting with the entire work group to go through those. And once that meeting is held, the board will be updated, I anticipate, at the February meeting. And anything, again, this is a draft. It's currently a draft of a policy or of a recommendation about the next steps in policy development. And that will again go before the full board as it always go out for public comment and before the full board before anything would be approved with respect to formal policy. Justin, I don't know if you want to say anything about that.
Oh, I just wanted to say thank you for everyone that contributed. There's members of the board, members of the community, HRSA, so a number and board officers that provide a lot of integral input. And there's a meeting next week set up with the three team leads where we're going to go over some of the feedback with HRSA and board leadership. And I appreciate everyone's patience and waiting for the results of this.
So it's both, thanks to Justin and the entire team who've done all that. I both have been told it's one of the quickest actions the OPTN has ever undertaken, and it's always slower than you think it is. So it's a good pace. And when we get it across the finish line, again, with public comment and approval by the board, we'll kind of stop the clock and see where we landed. But I think it's an impressive amount of work on a vital issue that has needed attention. The second item has to do with the next item has to do with the NRP work group. That work group has also completed its initial work of identifying areas where policy requirements or standards might be appropriate and have drafted some plain language summaries of potential policy concepts. They're being reviewed by the OPTN board leadership as well as HRSA, and that will also be presented as an update to the board of directors hopefully in February as well. And again, that draft of potential policy requirements and standards, policy concepts will be presented to the board, and any policy that gets developed would undergo the formal policy development, including public comment and board approval. The next item has to do with the update around non-citizen, non-resident transplant practices. As people will recall, in January, we discussed the fact that there was a media report regarding the transplantation of non-citizens, non-residents. We obviously take these concerns quite seriously, and it's a complex policy matter, and our responsibility is to address them through the established governance and policy development processes. So some things that are happening currently, one is we met collaboratively with HRSA, and they are discussing it with the other arms of government and agencies, and these agencies will follow their processes, which is not dependent upon the OPTN. The issue has also been discussed with MPSC, and that is the appropriate mechanism for OPTN oversight and investigations. They've reached out to appropriate programs and have requested data from centers. As you'll recall, the article went back to transplants in 2013. So those records are being located and collated and sent to MPSC for review. Additionally, the HRSA team is working on analysis of these issues and are doing a great job. The match run data is complex and it's taking some time. Additionally, we plan to draft a letter to all programs, just reminding them of the details in Policy 17 regarding how with the limitations around transplantation of non-citizens, non-residents, providing some clarity around what a government is, what a agency is, and the requirement really is that anything would have to be done at the level of an individual patient and referral from a doctor. So that letter will be going out once it is finalized and reviewed by the legal teams on both the OPTN and the HRSA side, and that letter will be shared with the board before it goes out. Additionally, once we're back to speed with respect to contract support, a targeted work, and these details roll in, we'll stand up a targeted work group to review the available findings and consider current policy for issues related to clarity, consistency, and identify any potential gaps. And that work group would also report to the board. for any need for both approval of where the work stood in any policy development. Um, then finally,
John,
yes, go ahead. Sorry, Jerry.
are you done with this? I wanted to speak before you finish this.
Certainly, go ahead.
So, I appreciate the work that's being done. I'm not happy with the way that we're responding to it, and I'd like to be able to have, at the appropriate time, a conversation with that. It starts with the way the issue is being described. I don't think the concern is that non-citizen, non-residents are being transplanted. I think what the New York Times describes is something they label transplant tourism. It's not necessarily involving governments, agencies. It's giving people of great power and wealth often access to our list, and that should never happen. And I think that sure there's room for investigation, everything, but I think it's also something that based on the facts we have, we could write a stronger letter than you described. It makes clear not how you comply and continue to do these types of transplants in their existing policies, but in my view, to make clear that this is just unacceptable and needs to stop immediately. And so anyway, however you want to today, coming weeks, whatever. But I think it is an urgent matter. I think it's taken over a couple of months to get where we are. It's taking way too long, and I think it's a test of how we work as an organization. I think this is an urgent issue, a critical issue, and one that we need to demonstrate that we can act more effectively and quickly on.
Thanks, Jerry. Sorry, I also didn't. The screen is too small for me to see your hand up, so apologies for not recognizing you had your hand up. I think those points are well taken. As was mentioned, the board will see that letter. I think the key is we have a scope of what we can say, and the board is not. But the board is charged with governance, not making policy. So I would be interested in seeing what we can state as unacceptable versus enforceable. And
well, again, I'd like to. I mean, so how the work that's going on now, is there a group or something that you've assigned to lead on this?
we're asking HRSA to look at they're working on a letter with Foley Hoag, and once that letter gets, again, it's mostly about what we can say, but once it gets and before it goes out, I'm fine sharing it with the board as well.
Well, can I participate in those discussions?
Certainly, once we formalize the letter, we can have.
Can I participate before the letter is formalized?
It's not it's not formal. I think something down and leaving it with the empty paragraph is fine to get many people's input on.
Look, John, I mean, again, I don't want to take up too much time today, but I think if HRSA and the lawyers, others are going to do their work, there needs to be some guidance on what we're expecting. And I'd like to be part of those conversations.
Certainly,
you're doing an excellent job, but I feel like, again, just starting with the way you're describing the problem, I don't think reflects the way what the problem is.
We can certainly, I'll work with you to draft the paragraph you're thinking about, including and as well
again,
as,
I don't want to belabor this, John, but as a member of the board, I feel like I have a right to participate in this policy discussion. It's not something that some other people. I mean, you're participating, others are. I'd like to participate as well as an equal member of the board from the start, not at some later point.
Certainly, we'll take that under advisement and think about how to include as many board members as possible. So, Doug, we can reach out to a group to just look at that letter.
Certainly.
Or, and it's not, and as Jerry, as I've made clear to you too, as well, it's not even it's a draft, it's a bullet point draft at this moment. So we're kind of just asking what does the policy say and what are the rules around it, but we can review it with any board officers interested in looking at the letter.
Yeah, I just think to move forward and be efficient as a group to let steps go forward. And, here's an opportunity to be involved right at the start, save time, make sure that we're working in a direction that's going to have the support of the board. I just don't understand the resistance of, we'll take it under advisement, we'll consider it, you'll see it later. Anyway, I don't want to take more time. Yeah. I object to the way it's being done, and I think we could do it much better. And again, it's not just this issue, but I think this is a good example and test of how we're able to operate in real time with important issues.
Great. John.
Again, not to take too much time. The bullet item says update on report regarding transplantation? Are we going to see a report as a
No,
board
that
from
report was,
HRSA
that was the,
before?
yeah, that was the report. That was, the report meant the news or paper article, or it's not a formal report.
Okay, so we're not
So you'd
receiving a
see,
report from HRSA.
not yet, because again, as I mentioned, there's still investigation going on. There's the New York Times report, and then there's so that report, wrong word choice. Thanks. No, thank you for calling that, because Shelley.
Yeah, the only thing I would add is it is not our job as a board to respond to media. Our job is to gather data to determine if media allegations have merit or weight. And then if we find that, which sometimes we do and sometimes we don't, then we move forward along the appropriate pathway. Some of this is CMS, some of this is purely legal, and some of this may be under OPTN and to be under MPSC. So there are processes in place once we get the appropriate data, which has been requested and is being collected. But until we have that data, as a board, we cannot do anything because it's not our job to respond to media.
Other comments? Thanks. All right. Thank you. The next item has to do with the call for committee nominations. As a reminder, you should have received, all the board members as well as the public, an email went out with nominations for 2026 committee positions. They're being accepted through March 16th. Please encourage your colleagues or anyone interested to apply via the OPTN website. The terms for newly appointed committee members will begin July 1. I've been asked a little bit about the committee process, in both that the nominations committee, which Shelley is the chair of, will be in charge of that, and it will follow the normal procedures. There's no one other than the board that's in charge of those appointments. So it is not a contractor that's not in charge, and no one outside the OPTN. So just as a clarification about how that process will work. So
In terms
go
of
ahead.
etiquette for that, is it acceptable for us if someone is interested to have a preliminary conversation just to help them understand about the committee, or would you rather we direct that?
100%, please reach out, and you can do thanks, Mary. You can do both. Like, just tell them what you think the committee is about. I can try and tell them what I think the committee is about. And we can also give them resources, but I think the more engagement, the better. So I think that's entirely consistent, not violating any rules, and
Super. We sent it out to some of our critical care docs because I saw that there was some expertise in that committee. So wanted to direct them appropriately.
Great. Thank you. Yeah, so please, and I think there are a good number of people that have been interested in, we again, March 16th, which our processes are kind of locked into both public comment and other things we do. We can't extend things kind of just casually. So we have basically another 4 weeks. So, and then finally, I wanted to touch on issues related to OPTN modernization. Again, in this period of transition, unfortunately, we always need to focus on the resources available, which was a challenge and a present task for the board before this transition started, and it's going to be a task of the board after the transition is. But particularly during this period of transition, we need to make sure we focus resources on the things that are biggest threats to the OPTN and to our patients and donors. And I've been asked about committees just holding meetings. I've both been asked, and I've asked multiple times myself, can't we just have a meeting? And unfortunately, we can't. The way we are structured as a public-private partnership, as I mentioned before, we need all arms of the organization, which includes the volunteers, our HRSA colleagues, and the contractors to meet the requirements for OPTN meetings. So thank you. I appreciate everyone's patience in that, and it's just structurally not the way we can can do things responsibly. It opens us up to risk. It opens us up to bad processes. So again, focusing on governance is really what we need to do as the board, and hopefully in the next near future, we'll be onboarding the new contractors and working with them, and also working with the committees. I also wanted to mention we've had the opportunity to meet with both the committee chairs and vice chairs to talk about where things stand currently. It was a broad meeting about just the challenges of the transition. We plan to have another one in the near future, potentially expanding it to all committee members who want to attend. I can't remember the date we're thinking about, but hopefully in the next couple of weeks. And then we also met with the regional counselors just to touch base with them, the board regional counselors, just to because they're often the first path to the board, just because that's who people know how to contact, and that's the way the system has always worked. So that is it for my broad updates. We're going to leave this slide up, and happy to ask questions, or happy to answer questions. Sam.
So I just wanted to ask about the bulletin that went out on the 9th about the change in monthly routine allocation review, saying that now, rather than the way that it has been done prior, HRSA and the OPTN are using the out of sequence dashboard, which is readily available on the website, and OPO allocation compliance reports. I've gotten multiple questions from OPO members asking how they can access those reports. There's a sample one on the website, and I understand they can't all be publicly posted, but can an individual OPO get their own report, and how would they do that?
Yeah, thank you. So this had to do with the idea that we're ratcheting back the reaching out to the OPOs specifically, but as you mentioned, there are OPO specific reports. I'll let Brianna or Sarah talk about the specifics because I know the reports exist.
Yep, happy to, John.
Thanks.
Sam, we're working on this right now. Part of this is ensuring a safe delivery mechanism. As you can imagine, ensuring that there are regular, secure deliveries of this information, or a place where we could put these in a repository, is something that we are working through technical solutions. We're also working on establishing the consensus AOS data set, the allocation out of OPTN sequence data set that everyone would also be able to use, right? To hopefully dig into that data themselves. And our data team lead, Dr. Sarah Lasky, is very close, has been working with the DAC on establishing that final data set. They've been working through edge cases. But I think the only barrier we have right now is just figuring out a smooth, replicable, standard way that we could get those individual OPO reports out on a continuous basis. And we want to do something that's not ad hoc, but is sustainable, if that makes sense, Sam. So I think for right now, what I can commit to you is we'll continue to find the right technical solution. We have a couple of interim things we could do with sending out like large secure emails to every OPO member, OPTN contact. You know, there's just some logistical things with that not everyone opens their emails or would recognize what we were providing. Like, would it be easier for us to have you all come to a centralized location to pick them up instead? Give us a little bit more time to get that figured out. But yeah, the plan is to be able to get them to all of the members in a secure manner on a regular cadence prospectively.
Thank you.
I also open it up if Brianna or Ray have any updates regarding the modernization component of things. There's really, from our perspective, there's not a lot new. We let the board know about the RFIs that went out, and that period is now closed. So
that's right, John. I think everything is proceeding according to the federal requirements around procurement, meaning contracting and procurement. And we're excited for these next steps. We also commit to you all once again that as we have taken on this operational stewardship role, we are learning so much, and we are documenting every step of the way. And we are excited to be able to share back with the board what we have learned, share also with our HHS colleagues, and just make sure that we're, standardizing things that were maybe not clear to anyone, even longtime members of the OPTN or longtime volunteers or folks who are in the community. This bridge period is not easy, but it is deeply valuable, and we are so excited for the next steps in introducing those new contractors when those awards are made.
I think thanks, Brianna. I think for many of us, we've not known any different system. But in working with some of the people volunteering, particularly in MPSC and DTAC, and probably more MPSC, I think the opportunity for positive change, they like it a lot. So, learning new systems is hard, but it'll be the process towards a better system. Okay. I thought I saw a hand up, but all right. Other questions? Rio?
Hi, thanks for allowing me to speak. I just wanted to offer the notion or the thoughts that SRTR also can contribute to access to data if HRSA needs us to do so, because we actually do a lot of these analyses and have access to data, and at least Carly, we do, and not only with the match runs, but with other data sets that other folks have said they would like to have access to. So obviously we go through HRSA approval to allow that sort of access, but we do have established secure sites, etc. So thank you.
Great. Thanks, Rio. And
we're aware. Yep. Thank you.
Yep. Okay. Any other items? All right. Well, I don't see any. Hopefully, as I mentioned, in the next board meeting, there will be. I don't have a good sense of the timeline for the OPO and the DTAC to respond to the public comments, but hopefully that will be in the near future, and potentially as soon as they become available, we'll forward them to the board and move forward with the rest of the process. All right. All right. With that, the board is now going to move into closed session. I thank the public participants for participating and your engagement in the OPTN.